Okay, welcome everybody. It is good to have you here. Let us get going here. Let's go. Welcome everybody. It's so good to have you here. Let me put up the chat so I can see it and questions and answers and the chat, and tell me in the chat who you are, where you're from, what kind of healthcare professional you are. Well, first of all, tell me that you can hear me, tell me that you can see me, tell me that you can do all of those things. That would be great and greatly appreciated. So go ahead and put it in the chat. Welcome, and you can see me, you can hear me, and you can see how many people we have got on here. And I am so glad that you are here because this is going to go to capacity so fast that, and you can see for yourself, these names are coming way too fast. I am so appreciative that all of you are here. And so thank you so much for being part of it. You can see that we have got physicians, dentists, nurses, nurse practitioners, PAs, dental hygienists, estheticians, people that can inject in their own states here. It is so good to have all of you here for that. So keep putting that in. We've got international, Istanbul, I see just popped up, from Jonesboro, Arkansas to Istanbul to Cleveland my gosh, dermatologist from Armenia. I'm just trying to keep up with all of that. Thank you all for being here. It is so great to see you all. I hope that if you are in the US, because we do have international as well, as you saw, that you are nice and warm, because so much of the US has come under this crazy, crazy storms. So I hope that you are safe. I hope that you are warm, and I hope that you enjoy this program. And let me put up let's go ahead and put up these slides here. All right, so the only other thing I need you to do is to tell me that you can see my slides. Let me put it into full screen. I just got to move it around. Give me a second so I can kind of move things around so I can get the full screen there going. And that is good. Hang on, almost at full screen. Let me figure out how this goes. But thank you so much for being on. Here we go. We should be at full screen in just a second. Let's see. Does that work? That works. Okay. Let me put up the chat again. Let me put up everything so we can see it. Okay. Can you see my slides? Can you hear me and see me? Everything looks really good. Thank you all for being here. I'm going to jump right into this because we have got a lot to cover here. Feel free to ask questions at any given time. We have got some people from the AAFE that are on as well, that are here to help you, because I'm sure we always talk about training. This is a super popular subject, which is really interesting because dermal fillers, everyone knows Botox, and certainly Botox gets a lot of press. We'll even show you a little bit of a combination Botox and dermal fillers case. But dermal fillers is where you can really make magic. And we're actually going to show you 4 different videos we're going to show you dermal filler, the hyaluronic acid dermal fillers. We're also going to show you something called solid fillers for collagen biostimulation and actually for lifting the face. So hang on, we got a lot. We're also going to talk about patient fees, and we're going to talk about financial impact on the practice. We're going to touch a little bit about how to go ahead and build that aesthetic practice, whether you're a physician, dentist, nurse practitioner, PA, everyone wants to get into this business. So we'll just show you how all of this kind of fits together for all this. So I'm excited to be here with you, and I hope you're excited too. So let us get this party started. My name is Dr. Louis Maltzmacher. I am president of the American Academy of Facial Aesthetics, the AAFE. I am a clinician just like you are a clinician, and I've also got a whole bunch of faculty, AAFE faculty members who are nurses, nurse practitioners that work full-time for the AAFE and also see patients, also do training, and I oversee a lot of them as well. So we know a lot about the business side, but we're going to focus on clinical and do a little bit of business there too. There is my email if you want it, drlewis@facialaesthetics.org. If you want the AAFE, there is the AAFE's email. We have Haley on from the AAFE that can answer questions as well, because there's always a lot of training questions. We'll talk about it just a little bit, but we're going to be mostly clinical. But if you're new here, especially, you might want to take a picture of this slide that has got a lot of different resources some of which we will touch on, most of which we will touch on as we go through this this training here. So, but keep putting in as you're joining. There's still a lot of people joining almost at capacity. So I'm really glad that you guys are in and made it here. So as you join, go ahead and put in who you are and where you're from, and you can scroll back in the chat that everybody can see. And see the kind of incredible response and crowd that all of you are here for. Follow us at Facial Aesthetics and all the social media channels. That's where you can find us, because we post clinical things just about every day. There is a tuition special that the AAFE always gives out at these webinars, only for these webinars. You will not find it on the AAFE website. So this is where you will get a very special deal on training, really the best deal that's out there, aafespecial.com. Whether you're new and it's for our foundational level 1 Botox and fillers, whether you're a little more advanced and you want to take a level 2, level 3 is a very comprehensive master courses in Botox and fillers. We have a real curriculum, and that's the best way to learn. And this is all CME certification training. Don't take your training from someone that cannot support you afterwards. We have got a whole team that is just here to make you successful and to clinically and also build the practice of your dreams here. We got a lot of other courses. We'll touch on a lot of these courses as we go through. We have the absolute best faculty in the world, 80 of the top clinicians around the country, and they are nurses, physicians, dentists, nurse practitioners, PAs, optometrists, in some cases, can go ahead and deliver Botox. We've got dental hygienists. We've got everybody, and we learn from everybody. And that's really the secret for that. And we also have the highest ratio of instructors to attendees. So that's really important. You're going to learn from people that have successful practices that you want to build, or people just like you. aafespecial.com. This just gives you an idea of where we have all of our trainings, which are all over the country. As you can see, the stars are actually AAFE training centers where we run most of our courses every single month. We're in all these other locations monthly or bi-monthly, so you have an idea. But it also tells you there are only 12 of these special packages available. Let me spend 2 minutes on going through it. Then we're going to jump into the clinical and really go pretty deep into the clinical. AAFE special only till midnight tonight, plus all these bonuses that you will only find at aafespecial.com. This is only till midnight tonight, or the first 12 packages that go. QR code if you want to get there. This is an amazing package. This is for those of you who are getting started. This is our level 1 core 4 package. You have 2 choices to go ahead and choose from. Level 1 Botox, this is all in 2 days. And these are, again, specially designed courses in most locations. It's over 2 days, 4 courses. It is the least time out of the office, the most comprehensive training you're going to get. You can go ahead and start seeing patients within 14 days, as long as you got all the other things covered. Again, if you're a dentist, you already have an office, or a physician or a nurse practitioner, you can jump in right on this. If you're a nurse, then we can help you figure out what else you need to go ahead and do to open up, or you're getting a job in a med spa, or you want to own a med spa. I'll touch on that a little bit at the end here for that. So 4 courses all in one 2-day event. And if you're a dentist, you may want to go for level 2 Botox as the 4th course, or you may want to go for Gum Builder as the 4th course, which is a regenerative filler for gums for that. But all of you, this is hands down the absolute best and lowest course for this. Thank you, Priscilla. Very nice. Thank you for saying this. She just did the core 4 in Philadelphia as an RN. Definitely worth it. It is worth it. And I want to make, again, I want to talk to physicians, everyone who's not a dentist. Dentists certainly are going to take the level 1 TMJ oral facial pain trigger point therapy. But I will tell you, if you're a physician, you're a nurse practitioner, or PA, that course, the level 1 TMJ oral facial pain trigger point therapy, allows you to really deliver these services in a med spa or medical practice setting, because everyone loves to pay for the aesthetic part. It's all fee for service. There's no insurance nonsense. But oral facial pain, headaches, migraines, those kinds of things in a med spa environment will explode your practice, because people make, they have a decision to make whether or not they want to pay for aesthetics. Most of the time they do. That's why this is such a hugely popular industry for that. But This, the pain part, they can't live with the pain. And you can go ahead and treat it. And Kristen, thank you also for popping up. She just did Core 4 in Overland Park, Kansas. Absolutely worth it. That's so kind of you to say. And you will get all these bonuses. Bonus number 1 and a lot of bonuses worth a lot of money. But I'm just pointing out bonus number 1, the Med Spa Aesthetic Practice on-demand training, because we will show you from the beginning to the end everything you need to know, from the legal structure to the accounting structure to consulting with patients to hiring employees to being an employee. All of those things are in that course. It is the most comprehensive business on-demand training for the aesthetic space that you could possibly get, plus everything else. $1,500 worth of injectables. One team member for each one of those courses worth another $1,500. Post-course support, 12 months of AAFE membership, a member office locator, all the forms you need, additional discounts. This is the best package and the lowest per course price you are ever going to get from the AAFE. Plus, again, you won't find all these bonuses on the AAFE website. They're not coming with these bonuses. So there's no compare. So if you want it, get it. They're only 12 or until midnight tonight for that. Second package is the Dream Practice package, and this is a 2-course package. Now, if you notice, this 2-course package is $3,000. That 4-course package was right under $5,000. So if you bought 2 of these, that would be $1,000 more than that. Absolutely. Core 4, it's 1 2-day event. We give them all over the country constantly. So that's what you're going to take them all for at one time. That is going to be your building block. And again, thank you for the testimonials on here. These 2-course packages, you can take your pick of level 1 Botox and filler, level 2 Botox and filler, which is more advanced, level 3 Botox and filler. I forgot to add Botox here, which is really, like a master course in all of this. Inject and dissect the cadaver lab and aesthetic ultrasound. Lifting PDO threads. I'm going to show you lifting PDO threads. You can mix and match really any 2 courses there. Also comes with less in terms of the bonuses, but also very worthwhile package if you want 2 courses. And then this is for those of you who have some experience already, and this is the Career Growth Online Certification Special. We've got all these online certification courses in hyperdilute radius and solid fillers, PRP, PRF, Master Total Facial Aesthetics, lips, eyes, nose. You can see it for yourself. Buy 1, get 2 free. This is really great. Again, if you have some experience, I didn't mention this, but this Core 4 package, once you start seeing patients, this literally is 4 to 5 patients, pays off your tuition, and you have these skills and this talent for the rest of your career. This takes literally 2 to 3 patients before you paid off. I mean, when you think about it, every Botox treatment is $600 to $900 easily. More comprehensive you get, the more it's going to be. Dermal fillers is easily $600 to $1,200 per treatment. Your tuition, it doesn't matter. You want the best training available, and that's what you're going to get with the AAFE. And certainly if you're more advanced already, these are great certification courses that are all on demand, so you don't have to leave your home or your office for that. So this is 1 patient pays this up for sure. That's pretty much how that breaks down. We'll get into more economics a little bit later. All in one place, aafespecial.com, QR code. If you have any questions, Haley's in on the chat, and then she can go ahead and take care of you. Maria attended the level 1 courses. Now I'm interested in level 2 with PO threads and TMJ. She'll put a package together for you, but I'll tell you what to lock down there, Maria. So Haley's on here too, and she'll be able to respond to you as well here. All right, let's get into this. Dream Practice with injectables. What do we love about it? Whether you are doing this already or you're not doing this yet, we love it because it's a recurring revenue center. Botox lasts for 3 to 4 months, then they come back again. Fillers last anywhere from 6 to 12 to 18 months, depending on the filler. Then they come back again. They come back again over and over and over and over. They're the most popular aesthetic procedures in the world. You get paid what you are really worth. And it is a dream practice. I can tell you from my own experience, but I can also tell you from thousands of AAFE members, some who are on here, that it's unlike anything else in medicine or dentistry or nursing. It's the most fun you're ever going to have in healthcare. People pay. There's no insurance nonsense. Aesthetics is the great equalizer. What I mean by this is no matter what the degree is after your name, any healthcare professional can be the best injector. It takes training, experience, more training, experience. It's how you got to where you are today, right? It's how you got your RN, your NP, your PA, your MD, DO, DDS, DMD, RDH, whatever all those letters are after your name. It doesn't matter. You can be as good as the best plastic surgeons. Some plastic surgeons are good at it. Most want to do surgery, so they kind of use it as a feeder. They're not that good at it. That's why you have people like us that refer people to the plastic surgeons, and then the plastic surgeon says, you know what? Just send me patients. I'm going to send you my injectable patients because I don't really like doing it. I want to do surgery. And we refer a lot of patients, and so should you. No capital investment, no huge inventory. These are non-surgical, minimally invasive treatment. Take only minutes to accomplish if you are well trained. If you're not well trained, that's when you get complications and you spend your whole life trying to figure out complications. You won't have that with the AAFE because we have total post-course support. Our forums, we've got full-time faculty that will answer your questions. And I always say to people that are just getting into this, ask your friends and family if you should offer Botox and fillers. By the way, AAFE members in 2025 were up 35 to 45% in their practices. So if you've been thinking about doing this for a while, this is the massive kick in the pants, because really, when you think about it, the tuition is an investment in you. Your patients are spending more than $5,000 a year investing in their own faces. How about it's time for you to invest in yourself, even if you've taken a level 1 already, and really add on to your services. Or if you're just getting started, it's really a dream. It's the dream part of medicine or dentistry or nursing for that. Aesthetic, and you will see constant articles about this in a lot of the beauty magazines and just consumer magazines. Aesthetic investment, spending more despite economic strain. The last thing anyone will give up is themselves and their face. As a matter of fact, the more anxious and depressed, COVID, all that stuff. During the COVID years, everyone thought we'd be out of business, and people were coming in droves. They almost couldn't go anywhere else. And the one thing they kept investing in was their own self-esteem, pretty much. That's exactly what it comes down to for this. So absolutely, it is time for you to do this. Let's get to this here. Let's talk about facial aging just a little bit. Again, I'm giving you the overview. I'm going to show you. I really want to get to the videos, because that's where you're really going to learn a lot. But this is about facial aging. When you talk about dermal fillers, it's going to be about volumizing the face again. It's about facial aging. Look at this. Grandmother, mother, and daughter, little daughter. Look how much they look alike. But you look at the daughter, she's got a face full of collagen. You look at the granddaughter, I should say. Look at the mother here, which is in the middle, and she's got nice cheeks and everything else. Now look at the grandmother. This is going to happen, and it does happen to all of us, is you have got facial aging. I mean, she's a perfect example of it. Losing a lot of collagen in her cheeks, everything starts to fall down. She gets these nasolabial folds right here, longer upper lip, and thinner lips. I mean, jawline, jowls. You just get everything because you lose that collagen, you lose that mid-face volume, and you lose it in your lips too. And that's what we're going to really go ahead and concentrate on. And look at these. I may show a couple more of these over this program. Look at these. 29-year-old, who is this? Jennifer Lopez. I'm not as good with culture. I think that's Jennifer Lopez. Look at her at 29 and look at her at 55. I think she's even a little older now at that. You could almost argue she looks better at 55. Doesn't have to necessarily be younger, but she looks better at 55. Look at that facial proportion. That's what all of you can go ahead and give patients. And by the way, I cannot discount this at all, because what is so incredible about the whole injectables thing right now is now up to 40% of the patients coming into injectable offices, med spas, our offices, medical dental offices are Gen Z and millennials, which means they're under 40 for sure. Gen Z itself now makes up over 30% of these patients. They're getting lips, they're getting a little bit of baby Botox, they're getting a lot. They're going to be patients forever. I wish when I started, which is over 20 years ago, when, who was coming in? The 40-year-olds, 35 was young. Now they're coming in at 18. They're coming in at 20. Their fathers and mothers are buying them lips for their 21st birthday. It's wild. It's really wild for that. All right, here is what we are built on when it comes to the clinical: anatomy, safety, and technique. This is our mantra in the AAFE. Nobody else teaches it like this. This is all about the anatomy. It's about safety, but technique is everything. And no one spends enough time on technique. And that's why we spend so much time on technique and safety and anatomy. That's how you get great results. That's how you become a great injector. If anything, I always say this in the AAFE, so we are anatomy crazy. I could spend the next 2 hours showing you a lot of cadaver videos. I won't. I will just show you one little cadaver slide coming up next. But what are we worried about mostly when it comes to dermal fillers? We're dealing with replacing facial volume, whether they never had it in young patients, whether they lost it in older patients, for that, with a jelly material, which I'll introduce you to soon. And that is going to be a dermal filler. And what have you got to be worried about the most? You've got to be worried about vascular events. You've got these big arteries that course through the face. I don't worry about it because I know where they are. You won't worry about it either because you'll know where they are. That's exactly the point of knowing the anatomy very well. And if there is some kind of a complication, we spend so much time in AAFE training on dealing and getting rid of that complication. And it's pretty much that. You cannot get trained in this and know a little bit about complication management. You have to know everything, and you will. And the truth of the matter is, it doesn't scare anybody. You're a healthcare professional. We all deal with complications and things in our medical practice, dental practices, nursing practices. Every single day, there are always complications. It's knowing what to do with it and having treatment protocols, which the AAFE has for you to tell you exactly what you need to do for this. But we want to stay away from these arteries. We don't want to compress them. We certainly don't want to clog them. And it's really rare, but you got to know what to do just in case. But you really have to know the anatomy for this too. And should have given you the warning about cadaver slide coming, but you're going to have to know all these things. And again, we don't need to go through them now necessarily for that, because this is all going to be built into AAFE training, no matter what level you go ahead and go through. But you really got to know it. Again, you've got to know the muscles for neurotoxins and Botox. You've got to know the arteries and the facial planes for this. The nice thing about anatomy and facial anatomy, all of you know this. This is already in your brain somewhere, because no matter what kind of healthcare professional school you went to, this is literally was your first semester. Second semester, maybe just on head and neck anatomy for that. Just really depends. But literally, it's in your brain somewhere. We just got to pull it back out and really see now how it applies. We have a whole separate course. If you're already an injector, you've got some level 1 experience, level 2. We have a whole deep dive, inject and dissect cadaver lab and ultrasound training. That's 2 courses, 1 day, and here are the upcoming things. There's nothing upcoming dates. There's nothing else like it, by the way. You could use a 2-course package on this. If you just want to buy this separately, the matter is, if you buy it separately, even with $1,000 off on this, it's still $200 more than the 2-course package. So you might as well buy the 2-course package and get all of those bonuses for this. This is for, again, at least you've taken a level 1 already. It's a deep dive. You will inject in cadavers. You will dissect them down, see the different planes. Don't worry about it. If you've never been trained, this will be in your future. It'll give you a whole new appreciation. But you're going to really learn about anatomy in every single AAFE course. I want to show you a quick video about how do dermal fillers work. Here is a great little way to show you how dermal fillers work really quickly. Here we go. Here is a perfect way to see how fillers work. And just take a very dried tomato, not completely dried, and put some filler in. This could be any filler, and you add volume, and you're going to see it expand. And what you're also going to see is something fascinating, is there's a certain point when the tissue just can't take any more filler, and then it starts to express out. That's an important point. Keep that in mind. You can expand tissue and add more filler later, but this is a great little demonstration on how filler works. Okay, and that's pretty much what you're doing. You're replacing volume. Either it's loss of volume for older patients, or they never had it, and that's very common for a lot of different patients. I mean, it just depends. They are volumizers. We're talking about this kind of filler. I'm going to introduce you to solid fillers. Some are regenerative, some are for lifting. So we're going to show you different kinds of fillers. But I want to show you two cases of dermal fillers as volumizers in the cheek and also in the lips. Then we're going to show you the other fillers there as well. So fillers now incorporates a whole lot of different things when it comes down to a Juvederm, Restylane. These are the popular fillers. This is what they would look like if you put them on a glass slab. And pretty much they're a clear colorless gel. They have different densities. Some last longer, some last shorter, some are more flexible, some are more firm. Here are some of the available dermal fillers in the US. Some of you are international, and international, they've got about 500 fillers that you could choose from. There's one line missing, the RHA line. They're all great fillers. In the US, we are blessed. All of these are great fillers. They're all tools in the toolbox. How do you decide what filler is the best, what filler is right? Depends on what you're doing. Depends on your patient assessment. Do you want a flexible filler? Do you want a firm filler? Do you want a light filler, a medium filler, a heavy filler? All those things, again, you work. Evolus is another filler that's out there. All fillers are really good fillers when you use them for the right clinical situation. That is really the key to all of these. So you've got Revenus Versa, Versa Plus, Versa Lips. Most of these, if not all of these, have lidocaine in the syringe. That doesn't mean you shouldn't get your patient numb, at least with topical anesthetic, because the first few pokes are going to hurt for that. So it really just depends on what your clinical situation is. The workhorses, if you want to know what people use most of the time, is Juvederm Ultra, Juvederm Ultra Plus. Restylane L is a good one. You have got Versa. Versa is a good all-around filler. If I've got a patient that needs more volume, Voluma by Allergan, the makers of Botox, is the most popular filler in the world, but it's a heavy filler. It'll give you a lot of volume very quickly. You don't always want that. You've got some flexible fillers. You got to know when to use all of these fillers. They're all good. There's no FDA cleared filler that's on the US market that is not a good filler for the right clinical situation. People ask all the time, what's the best filler? Well, what are you doing? What's the best tool for a screw if I want to screw something into the wall? It's not a hammer, right? It's a screwdriver. Is it a Phillips screwdriver or is it a flathead screwdriver? Is it, one of these star screwdrivers? I don't know that much about screwdrivers. But what's the best screwdriver to use? It depends. It depends on the screw. Exactly the same thing here. These are all tools in the toolbox. So that's really, really important for you to realize here. All right, let's go to a video. I'm going to turn my video off so you won't see me while this plays so that you have a better experience. So here we go. Now let's do Dana's left cheek here. And we are going to go ahead, pretty much repeat the process. Anterior cheek first on her because she needs it all the way across. So we're going to start on the anterior, being careful of the informal foramen, know the anatomy, keep that moving, and we are going to go ahead and deliver anywhere between 0.05 to 0.1, never more than that. Keep watching the tissue. That's super important. And that becomes the focal point for now the rest of the injections. And you've got to know exactly how to go ahead and proceed. You are touching bone and then pulling off a little bit and then going through your entire safe injection perfection protocol of slow injections. Keep the needle moving after you place the bolus here. Watch the tissue, make sure there are no changes, and know that anatomy. And again, if you're not on bone, then you are not going to get any of the support and any of the push out of that cheek enhancement. And we are using a heavier filler. In this case, we are using Voluma It can last anywhere from 12 to 18 months. We usually tell patients about 12 months because everybody is a little bit different. And this is really important. So you can see nice, smooth injection, but it is going to be a heavier filler on her. The reason for that is because she lacks a lot of volume. And again, this is an important point. It's lacking volume rather than she's lost volume. And we would treat those things a little bit differently because someone that is lacking volume, like Dana here, she's got good bony support in that zygomatic process. Somebody older that's lost volume has also had some bony resorption, and that really figures into your treatment plan because they're not going to have as much bone to go ahead and give you that bottom support to push all the filler up and support the tissues to give you those nice cheeks. By the way, look at the other side where we did the cheek enhancement on her right side, and look at that curve starting to develop. It's a little bit swollen. That's okay from the fresh treatment that she literally just had, but not very swollen here. Using the right techniques, and every patient is a little bit different, and you've got to give them time. That's going to absorb some water naturally, and though all of those things together are going to go ahead and give us and turn into those perfect cheeks. So right now we like it, and after it heals up and after a few days, we're absolutely going to love it, and so is Dana here. So that is what we are looking for that. Now you see how Jill does one pass of treatment here and then is evaluating it, and just keep evaluating it. See, the patient is very comfortable because she is talking through the entire procedure to Jill, who is injecting her for this. So you can go ahead and see and watch. Again, we're going to show you a number of things that's going to happen, because this question always comes up. Do cheek enhancement fillers lift the lower face? Well, you're going to go ahead and see in some of her before and afters how it's going to cause a significant change in this patient. Not everybody gets that change. The reason it's more of a change in this patient, which most people don't think about, is because she has lack of volume. And because she's got all the bony support, that will give her or simulate a little bit of an actual lift. If we really want to lift, we go to PDO threads for all of that here. And so now you can see we're just waiting for that, taking a look at it from a 3D perspective and really plotting out where else would we need a little bit of filler, and giving the filler a little bit of time to go ahead and absorb some water, just like we did on the other side. And now we evaluate, and now we go ahead and let's tweak it a little bit. We want a little bit more here or there, and you can see by the volume in the syringe how much we were using, and certainly it's not going to take very much. Let me tell you that anybody that tells you it takes syringes and syringes of fillers on a patient like this, and even on older patients here, isn't really properly placing it in the right place. And you can get by with a lot less filler. I'll say less filler, maybe not a lot less filler, if you really know where you're placing it, and you really know the anatomy, and you really know AAFE techniques. And certainly it's really about the live patient training and certification training to do all of these foundational or advanced procedures here. And now we're going to go ahead to smoothing, which is such an important part. I'll let Jill take it away.
So we're all done with Dana's cheeks. We're just giving her a little massage. We're using some arnica gel. This is going to help us really glide over that area. We don't want to flatten the cheeks, certainly. So you can see here, I'm sort of making some contour with my hands. And you just want to make sure that all of the individual boluses that you've placed have sort of just, we're marrying them together with the boluses next to them. So it just feels nice and smooth.
And here are before and afters for the complete treatment, including neurotoxin and dermal fillers here. First of all, to our cheek enhancements, look at those beautiful cheeks, and look what it did to our under eye. It eliminated those dark shadows. We did not treat the under eye there. Now look at the profile. Look at how it's raised and given her a snatched jawline, but we didn't even touch the jawline, and raised the under chin area for a much better profile view. And the 3/4 view is just gorgeous here, as you can go ahead and see, but all we did was cheek enhancements, pure form injection, lip enhancements, and neurotoxin, and getting this beautiful result, which certainly gave her some significant changes all across her face in this young patient. It's time for you to get AAFE certification trained today and learn these great techniques for your patients and your office. And I will say, but they never only get fillers. I can tell you that they get more than fillers. So I just want to just quickly show you her Botox treatment too, just for those of you who are new. But those of you who are not new, never been in an AAFE course, I want to show you a little bit how we do Botox. This will be a quick Botox thing. This is not just fillers, but one thing that I want to just go back to that one point that I really ended off that video with was, when you do mid-face volume, nasolabial folds, when you do cheeks, it affects the rest of the face. And this is certainly true for tear troughs and under eyes. Now, we do tear troughs all the time. We just did an online training a couple of weeks ago on tear troughs. It's more about the cheeks than it is about the tear troughs, because mid-face volume kind of repositions the face. It makes jaws look tighter. You need more than that. We'll get to jaws a little bit later, jaws and jowls a little bit later with lifting PDO threads. But there's so much you can do for these patients. But it really is about facial balancing and everything else. But you got to get started somewhere for doing this. What are possible post-op complications and prevention? Bruising, swelling, infection, nodules, anything related to needles in the face. I mean, needles on the entire body, pretty much. Vascular occlusion or compression. Again, the bruising and swelling are going to be your most common things, because people will swell a little bit. Some people are just swellers. Some people will bruise. You know, that we always tell people you're going to bruise. When they don't, you're a hero. If they do, they knew what to expect. It's in the informed consent as well. Infection is pretty rare. Nodules is pretty rare. Vascular occlusion or compression we talked about before. That's pretty rare, but you're going to have to know how to deal with all these, which we will teach you. Migration. Somebody mentioned migration before with lips. Lips, filler and lips should not migrate. And there are ways not only to prevent it, it shouldn't be happening at all unless somebody physically manipulated it, which is a mistake that some people make as well. But absolutely, we do lips all the time. Very few migrate, if any, unless something really goes wrong or was improperly placed, or you put too much in there. But we'll show you lips in just a minute. Hyaluronidase is there is a dissolver called hyaluronidase. Aesthetic ultrasound, all those different things we can use to mitigate complications. But most of it's about prevention and good anatomy, safety, and technique. Comes down to that every single time. I just want to show you her neurotoxin treatment there as well. We've got a lot of great neurotoxins on the market. Certainly Botox is king. Everyone knows Botox. Xeomin is a good close second, because it works exactly the same, except it's less expensive, little different molecule. All these are different molecules. The other ones are a little bit trickier to use. Our third favorite is Daxxify for sure. Then you've got a few others. All work. You got to learn how to use them. All tools in the toolbox for sure. But now this is really about the anatomy, and this is really about muscle anatomy, how muscles work. So we do a lot of programs on neurotoxin. Just want to show you, because it's the same patient. No patient comes in just for fillers. It's really rare. And very few come in just for neurotoxin, like your Botox and Xeomins. It's about learning more skills and putting it all together. I've said, I don't keep a close eye on the chat. The AAFE team does that. So thank you to Emily and Haley for that. So I'll come back and answer any questions, clinical questions, but they can answer the rest. But see, a lot of you have taken a level 1. Should I take a level 2? First of all, this is the best deal you're going to get on the level 2. And that's what that dream practice package is for, the 2-course package, number 1. But number 2, yes, it's about building and seeing how all these things work together. But let me show you a Botox real quick, Botox treatment on this same patient. All these patients should be getting neurotoxin and fillers together without a doubt. Now we are giving Dana her botulinum toxin treatment after cheek enhancements, after piriform false injection, after lips, and you'll see the total before and after. So we've marked her very carefully here, and this is actually her first botulinum toxin injection. She's never had it before. She's never had any treatment before, and this is quite the first appointment with all of that. So you can see we've mapped out her frontalis. We want an even distribution of botulinum toxin. Let's talk about the technique. Comfort Tox syringes, 31 gauge. the sharpest ones on the market for the most comfortable injections here. And we have a predetermined dosaging that we have determined on her, but we want it equally spaced around this frontalis muscle so that the frontalis muscle will become quiet and it will stop contraction in 2 to 10 days and really go ahead and remove, smooth the skin out. The skin's natural state is smooth, and any headache she gets from these muscles will go away completely. And you can see little red bumps that she's going to get. These are all going to go away quickly in the next few minutes. Every little part of the frontalis or skin is different. You can see one a little bit more swollen than the others. All will go away. Now let's go to the procerus muscle in the complex here, in the glabellar complex. These are the glabellar areas, the corrugator muscles, and you can see we are isolating that muscle. Every move we make is strategic here, and we are going in exactly on that muscle. She's got fairly mid-sized to longer corrugators, so we want to make sure that we get the continual spread along that entire muscle so it starts to calm down. And now the orbicularis oculi, or known as the crow's feet, we really stretch the skin and just glide the Comfortox syringe right underneath it. We're going to give her a little bit of a brow lift. Here you must know your muscles here and exactly where you want to go. This is an injection for her, not for anybody else, because we want to raise a little bit of that eyebrow just in that area. Other patients want it differently. Now the other crow's feet, and you can go ahead and see, we like to really add traction to the skin. So we will just go ahead right into that area here. These, again, these brow lift, this is a little bit more advanced. I caution you, don't do this if you're not ready for it, because if it gets to the wrong muscles, she won't be able to open her eyes. You've got to know your anatomy. You've got to know how to deliver this so it stays exactly in the muscle. Same thing with the chin muscle and the mentalis muscle, very, very particular and precise, because if you get into some of the other muscles, it will look when she smiles like she's had a stroke. Learn how to do this more advanced. Masseter muscle, you've got to isolate it. Make sure you're in the middle of the masseter muscle. Go straight in and give it as quick as you can give it. And with all those things and with the cheek enhancement she's had, well, here's the botulinum toxin. You can go ahead and see the before and after, and how things are nice and smooth. Got a little raise on the eyebrows as well, and the upper face looks great, but the total face really looks great. Cheek enhancement, piriform injection. Go ahead and take out the lips. We did lips on her. Look at the chin and how the chin has evened out with just a couple of botulinum toxin injections here. And we've smoothed the face totally. We've given it a whole different shape. You can learn to do all of this too. It is time for you to get AAFE certification trained today. Get yourself to a live patient certification course with the AAFE level 1, level 2, level 3, and you can get these kinds of results as well. Okay, it's about, what we like to call in the AAFE total facial aesthetics. That's really what it's all about. You can see her from the front, you can see her from the side. You can see her all the way around. It's a different person, but that's what they want. But I will tell you that Botox and fillers, I'll call everything Botox, but neurotoxin and fillers just goes together. It's hard to have just a Botox practice. It's hard to have just a fillers practice, because you want to add on to these services. But these two, Botox and fillers, I'm going to show you a chart a little later on, make up 50% of any aesthetic practice. So that you can't go anywhere without doing that. And again, that Core 4 package really ties it all together and gives you the most services to get started with right away for that. And again, I'll spend some time answering questions in just a couple of minutes, and then we'll move on. We're going to show you lips. We're going to show you regenerative solid fillers. We're going to show you lifting fillers. We're going to show you a lot. We're going to talk a little bit about the economics. If you're a nurse, if you're a dentist, if you're a physician, or whatever else you may be. Statin, yes, these are the best needles to buy if you are giving neurotoxin, or we backfill them with filler many times. These are called Comfortox. Why are they the best? First of all, they're inexpensive. Number two, they are the sharpest needles on the market. That's what you want. You want to be known as the most comfortable injector. Take the pain out of it. People will tell you all the time that, oh my gosh, I went to this injector and they killed me. It hurt so bad and that kind of stuff. You use the sharpest needle. That is the most comfortable needle. You can see a Comfortox in this micrograph right out of the package versus another popular brand that's at least 50% more right out of the package. Look how rough that is. Patient feels it. You'll feel it when you inject because it won't go in smoothly for all that. So this is it. This is the best. You can get it at statdds.com for that. All right, let me just address a couple of training questions. And again, Haley and Emily are on to help a lot of you. Core 4 package here. Again, I'm going to spend a minute about this and we're going to go straight to lips. Core 4 package is by far the most popular package. First of all, I think there are only 12 packages available. I think at least 6 are gone already for this. AAFEspecial.com. You get all these bonuses worth over $13,000. You will not find this on the AAFE website. This is only here tonight until midnight tonight or until those 12 packages are gone. And these are for the Core 4 programs, which are 2-day events. We give them all over the country. Somebody mentioned Illinois before. We've got a Chicago training center where we give these courses constantly. Again, you'll find them all over the country. And certainly don't worry about location. You'll get the locations you want. Lock this in before it's gone. That's really what you want. And you can take this 6 months from now. You can take this whenever you want. I don't know why you would. You want to start doing this right now. So level 1 Botox, level 1 fillers, level 1 TMJ, oral facial pain, headache, migraines, trigger point therapy, and level 2 Botox. Or if you're a dentist, you might be interested in the gum builder instead of level 2 Botox. We've got both of those programs going. $49.97. It is by far the best, absolutely the best programs that you're going to get and the most comprehensive for that. All right. And again, I'll answer questions in just a minute. This is the career growth. I think I might have skipped one. Here's the Dream Practice Package. These are 2 courses. Perfect if you want to take a level 2 Botox and level 2 filler, level 3 Botox, level 3 filler. Haley or Emily can tell you exactly what's in each one of those courses. The Cadaver Lab I mentioned and ultrasound training, those are 2 courses. Level 1 PDO threads, lifting PDO threads. We'll get to that. Really can do any 2 courses. Both packages include the Med Spa Aesthetic Practice on-demand training and a lot of other bonuses. Obviously, more bonuses in these 4-course package, the Core 4 package. This is more for advanced injectors or someone just wants to start with Botox and fillers. But if you just buy this for level 1 Botox and fillers, man, you should buy the Core 4 package because you are going to save over $1,000 because you're eventually going to take all of those other programs for really advanced injectors, online certification training in all of these things. Buy one, get two free. This is a really great deal. And I always say, this one will take you 4 to 5 patients to pay off, maybe 6 patients. And then that's it for the tuition. You've paid off the tuition, and now you've got the skills for the rest of your career. The Dream Practice Package, less 2 to 3 patients will pay this off. Again, every Botox, every filler treatment is $600 to $1,000. Doesn't take many patients to get your tuition back, and certainly not with a $997 investment. So here's all of it in one thing. Let me take 2-3 minutes to answer some questions. Then we're going to show you lips. Then we're going to show you stimulation with solid fillers and regenerative aesthetics for that. And then we are going to show you lifting threads, which is a different kind of filler there as well. What marking pens do we use? Some of you answered that. Thank you. Anything from white eyeliner to dry erase markers. Non-permanent, please. That's what makes them dry erase. Do not use permanent markers on your patients. Whatever you want. People ask me where do we get them, and I always say like Amazon or Walmart or whatever. It could be. Let me see if I can grab some of these questions. Thank you to some of you who have helped answer some of these questions. All the training questions I'm going to leave to Haley and Emily there too. Let me just see what other things. There's a lot to scroll through. How much filler did the patient end up getting in total? A syringe per side with placement on periosteum retrograding, or just laying bolus for that? So how much filler do patients get? As much as they need. What you see is what you get. She probably got less than a syringe on each side, maybe, maybe one syringe between the two sides because we're using Voluma. That's quite a bit. Or maybe 1.5 syringes, whatever the case may be. We'll always use the rest of that syringe on another place. These are supraperiosteal. So we're going down the bone, and then we're pulling back a little bit to make sure we are above the periosteum for that. We like to retrograde a lot, but on the cheek, if you can feel that zygomatic process, we can lay a bolus, but really low and slow. We really take our time, and we really watch the tissue and make sure that is doing it. But combination, we do retrograde injections and we do bolus. It just depends where. You're going to see lips in a minute. You're not going to see any boluses. That's only going to be retrograde injections for that. Let me just see if I can grab a couple of that was answered. That was answered. Let's see. Okay, let's go ahead. Let's take a look at this. Okay, that's a training question. Again, I'm going to have Haley and I'm going to have Haley and Emily go ahead and get into this. For dentists, we teach in just about every state, I personally have gone to just about every dental board and have talked about it, talked about Botox and fillers. So it is not a problem for a dentist. You can certainly get into it. We will show you how to do this within the scope of dental practice. Again, we've been doing this for nearly 20 years at this point. And we've trained a lot of dentists, that's for sure, for that. But we know all the nuances too, so we can really guide you for that. But there's not a single state where a dentist cannot do this. Okay, I don't see anything I haven't answered, but there are lots here. So if there is anything that I haven't answered, please feel free to ask it again. Ask it again. Confused about different filler types and each one's specific injection sites. It would take about an hour and a half to go through all the different fillers and where you use them, but you don't have to be confused about it. You're going to start off, again, if you're starting off, you are going to start off with the workhorses, the Juvederm Ultra, Juvederm Ultra Plus, the Revenus Versa, the Restylane. That's going to be, those are good all-around fillers. And then you'll start getting into some more of the specialty fillers. There are a lot of different fillers that are out there for sure. So that is that. All right. Packages are going fast. You have it in front of you, go to aafespecial.com, and you can keep reaching out to Haley or Emily who can help you. But these are all ready to inject live patient courses. And we're going to make sure you're ready to inject. We want you to start as soon as possible. And again, if you already have an existing practice, we will push you to get up and running and treating paying patients within 14 days. If you do anything else, other kind of practice or starting a practice, we will certainly have got lots of resources to really help you go ahead and do that. And start a practice there as well, especially if you're a nurse practitioner, whatever you need. Let's go ahead and talk about lips. All right, Sean, you can reach out to me if you're in Michigan. We've got Michigan AAFE members who are dentists that have got full aesthetic practices. We'll talk about and exactly how to document. And you've got all the tools already, but we'll all help you get through that with not a problem. AV lips. Let's talk about lips. Let's go ahead and do lips. So let me just show you a lip case. We're going to jump into this lip case right now.
So typically I'll go in, this is her natural kind of Cupid's bone. We did talk about this a little bit. She's not someone, she really just likes it more subtle. So I'm not going to go ahead and emphasize that at all. I'm just going to kind of fill the deficit. So little poke, checking my depth, good depth. And I'm just going to lay a nice linear strut of product. To save her a poke, I'm then gonna fan, so I'm not coming all the way out. Gonna fill this deficit here. I like my depth. I'm always tenting up to make sure that I still do. Nice, healthy strut, excuse me. A little bit of product followed me out, no big deal. Now you can see that this looks a little firm there, a little dimpled, if you will.
no big deal. We are going to smooth that out. I do not like to smooth while I'm filling. I like to wait until the end because the patient will swell and then we won't be able to tell what's what. Another thing, you might have just noticed that there was a little bleb of product at the tip of my needle. I see so often injectors wipe with their glove. We don't want to do that. We want to stay sterile. So I didn't want to see that. I just gave it a flick. Or you just go ahead and continue injecting. The filler's going into the body of the lip anyway, so it's no big deal if it's there. Here I am coming a little bit more laterally towards the oral commissure. I feel a little deep there. I'm just going to adjust. Keep in mind, this patient does have lip filler in here already, so we're going to feel a little bit deeper than we might on a patient who doesn't have any lip filler. Good. All right, I'm coming around to the other side. I'm going to have her turn just slightly towards me. And you can see how much more hydrated this side looks. We're just kind of filling in those deficiencies. Work my way up. Good depth. And a nice retrograde injection. That'll keep us safe. And then we're going to fill the body of the lip right here. Good depth. I'm avoiding the wet dry. We don't want to place filler in that wet area because it won't metabolize out. All right, open for me. So we had a little bleeding over here, a little bit of a bruise, no big deal at all. We're going back in. I'm just going to lay a little bit of product closer to the vermilion border just to get this area to pop slightly. Good. And now I'm going to move on to the bottom. So I like to change my needle if possible, if it feels like it's getting dull, just because it does provide a little bit more comfort to the patient. This all looks so beautiful. Now, if you'll notice, this patient has a little bit of this soft tissue swelling above the lip. That's not concerning. Of course, that's going to go down. It starts to look a little shelf-like. This patient actually likes the way that her lips look when they're a little swollen. And we talked about that when she came in. Sometimes when you wake up in the morning, or maybe you drink the night before, or you get a little bit of sun, sometimes your lips will end up a little bit swollen, and some people like that look. So that's the goal. We're going to kind of try to get her there with some filler. So I'm moving on to the bottom. I kind of just measure. I'm going to midline, and I'm going to fill this natural tubercle of the lip. Placing a nice, healthy, linear strut of product. And I'm going to do one more a little bit further back. Every patient is different, so my method changes. It's very patient specific. And bear with me, I'm just gonna change my needle real quick. It's nice because most fillers these days do come with 2 needles. So if you need to change, you can. I like to do it just for patient comfort, like I said. And then after, I'm gonna tell you about what we're gonna put on her lips. We do use Comfort Tox post-care lip kit. The patient goes home with it. It is a nice serum and balm, and it has arnica in it, hyaluronic acid, essential oils. It's completely homeopathic, and it's really nice knowing that the patient goes home with something that is clean and patient specific. So you can see here, she has this little bit of a divot right where those 2 tubercles meet. I like to really emphasize that because that's pretty. In patients that we can see it in, a little bit of a poke. This patient's doing great. You hanging in there all right? Mm-hmm. This side, I'm gonna fan a little bit and just fill this body. Good. I'm gonna fill the oral or closer to the oral commissure. Turn towards me, please. Right here, just slightly. And I'm gonna fill. You can see here where that filler kind of falls off. You can see it's nice and hydrated and plump. And we just need a little bit more in this corner. Always checking my depth and laying a nice healthy retrograde injection there. And I'm going to put just slightly more. You doing okay? Mm-hmm. Good. And I'm watching that tissue fill. So often we get the question, how much are you putting? How much are you putting? It's not an exact amount. We don't want to place too much in one area, of course. Turn slightly for me. However, you really want to watch the tissue fill. And that's the goal, right? We're not putting exact amounts in any area. I'm going to do one more strut, and then I'm going to make sure she kind of stops bleeding so we can take a closer look. This left side is giving me a run for my money. All right. So when I massage, everyone does this a little bit differently, but I like to take a gauze, and I always say I like to roll it like a hot dog. I learned that when I was young. This is hamburger way, this is hot dog way. So I wrap it kind of like a hot dog, and I'm just giving gentle pressure to kind of feel if I feel any obvious lumps or bumps. And I don't. I'm just kind of manipulating that product just slightly, working out any of those little bumps that I feel, and it feels great. And then down here, so right in the middle where I laid a little bit more product, I do feel a little bit of some firm product that I want to work out slightly, but just you can see just very gentle pressure. Doesn't hurt, correct? Good. I'm gonna hold a little bit of pressure there. And this patient is a little swollen, but you know, not terrible at all. They're looking really pretty. All right, so here we are. I have her all cleaned off. We have that one site who's given us a little bit of a problem, but nothing too big of a deal. I'm just gonna put that there for 1 second while I talk to you about this. So this is our ComfortTox Lip Restore Serum, and you do have to prime it a little bit the first time. So you just keep clicking it, and you'll see that little bubble of product appear. So her lips are now nice and clean. I did all the manipulation I wanted to do, and this is not single patient use. It's patient specific. So this is gonna go on now. It's nice and clean, never been used before. If the tip gets a little bloody, we can always alcohol it. This patient knows what to do with it because she's used it before, but watch these lips transform. Look how beautiful they are. So we have a little bit of blood on there, no big deal. I'm gonna clean them off. Put a nice healthy layer of this on. And then I'm gonna follow it up with the balm that comes with it. And these lips are just gonna look absolutely beautiful. And here we have the balm. I have it on a little applicator. I just put it on the back of my glove to kind of warm it up. And here we go. She does have a little bit of bruising on this right side where I went in a couple times, but nothing too alarming. Of course, she knows to let me know if she has anything concerning whatsoever. And as always, I will see this patient back to make sure everything is looking okay. I think these lips are looking fabulous. Go ahead and close your lips together for me. Perfect. I might have been a little generous with this balm, but it's looking really nice and pretty. I'm just gonna use a little bit of a gauze to clean up the sides. Pain-wise, you were okay?
Oh, yeah.
Okay, try to rub your lips together for me. Perfect, I know they feel huge. And there you have it. Thanks for stopping by, guys.
And here is a gorgeous before and after. Sydney is one of our full-time RN faculty in the AAFE and the AAFE Training Center where she sees patients. These are gorgeous lips. Look how small these lips were beforehand. And this took a couple of sessions to go ahead to get them to a really great full lip size that the patient wanted, that the patient absolutely loves. You've got to learn to do this too. It's time for you to get AAFE certification trained today. All right, so that is lips. You should all be doing lips. I will tell you that. The most popular filler service is always going to be lips, lips, and lips. ComfortTox Lips Post Care for Lips is so fantastic. I cannot tell you. So you should all be doing. If you do lips already, you should all be using this, and that's what she was using. It is literally so fantastic for really going ahead and just shrinking down those lips, and it's fantastic. So this is where you can get it from statdds.com. Don't quote me, especially. I think each one of these kits is $30 maybe for that. We do not give the patients a choice. Just include it in your fee, raise your fee for lips by $30, and then it is literally just in here, and you can go ahead and see everything that's in it. It's got all kinds of different things that are in it that are great for lips, and patients love it. They use it for a week afterwards, and they take it home. We put it on at the time right after that. It really controls swelling and bruising and eliminates it, and they use it for about a week. It's a balm and a serum, and it is so fantastic. We've been using it for years in the AAFE, and again, it's by StatDDS. The entire ComfortTox line, they've got cannulas, they've got all kinds of different things. They've got a BLT. It's amazing. It's really amazing. for what you use. I mean, we use it for everything. People want lips. They want lips now. And there are a lot of other techniques that we use in there that she didn't explain that really controls. Your patient should not get lips, walk out swollen, and then you got to tell them to hide out for 2 weeks until their lips come back. That's not what lips really are all about. There are some questions on lips. I'm going to answer those now because I really want to answer your questions. This is all about your webinar here. So let's just do this. So first of all, and Kathleen jumped in, so thank you. You should see, she said it exactly. You want to be deep enough, but not too deep. You want to see the outline of the needle, but you don't want to see the silver of the needle poking through. Then you are way too superficial for that. Generally, if you cause a vascular occlusion, you can see right away that the tissue will turn white because you block the blood flow, or grayish or mottled. Sometimes it does happen after a day or two. So for that, again, we'll cover all that in terms of complications management. Most time, yes, you'll know very quickly, and then you clear it very quickly while the patient's really in the chair for that. But definitely, I mean, a lot of different ways to do it. We throw everything at them when we are going ahead and doing complications management for that. But that's, again, it's pretty rare, but you better know how to go ahead and treat it here. Let me see if I can get how many times we change the needle and when you know it's time to switch it. You'll feel it get dull and it's hard to push through the tissue, and then we change it out. We've got a lot of other needles. You always save the needles. Typically, most filler boxes come with 2 needles. You always save the extra needles. We've got drawers full of needles in case I need to switch it out 2 or 3 times in a procedure. It's pretty rare, though, that you do have to do that. Aspirate, great question. Do you aspirate? Do you not aspirate? Turns out that, you've got lots of key opinion leaders that say you should never aspirate, as funny as that sounds. You've got other people that say you've got to always aspirate. We aspirate when we feel the need to aspirate. When you are at this depth in a lip, generally you don't have to aspirate, but you can always aspirate. Aspirate, though, I will tell you, gets way overblown as being so important. It's not. It's one tiny data point. So much more that went into the AAFE technique that you saw her do that's so much more important than aspiration, which is retrograde injection. Keep that needle moving, low and slow injections. I mean, I could count you off 10 different things that you'll learn in training with the AAFE. Even if you're ready to do lips, when you come to an advanced course with the AAFE, you'll learn these things too. Aspiration is one little data point. Why? Because aspiration is wrong 70% of the time. So don't rely on aspiration. But as soon as you move your needle, aspiration is irrelevant, the last aspiration you did. So it's really important to know what's important, what's not important. I like all the data points you could possibly get, but for that, what do you do with leftover product? That's great. The official position of the AAFE and of the manufacturers is you toss it. If you ask most practitioners, they probably do save it for a period of time, maybe a week, maybe 2 weeks. Don't save it for a long period of time. Don't necessarily even tell the patient you're saving it, because they'll come back a year and a half later and remember they had like a quarter of a syringe that they want to do their whole face with. Just bad practice management. It's probably not the best thing for them either for that. And we talk about that in the course. That cannula better for cheeks? No. Cannula and needle, they're 2 different instruments depending on what you're going to do. If you're good with cannula, then there are a lot of things you can do with a cannula. I'm going to show you use of a cannula lifting pedio threads. If you're not good with a cannula, 95% of injections are done with needles worldwide. So cannula is great to know. It's for definitely an advanced technique. It's when you want bulk smooth filling is what a cannula is for, but it's not for precision. That's what a needle is for. And there are some cases we use both cannulas and a needle for that. And Tori, thinking about a dream package. So again, we'll have Emily and Haley. They may have reached out to you already for that. Let me see if I got. These are really good questions, but I'm going to move on and we will go ahead and do this. We backfill ComfortDoc syringes all the time for that. We showed you a volumization lips treatment. We have about 10 different techniques that you learn as you go through level 2 and level 3. And we even have a master lips course as well, which got all kinds of different techniques. Sometimes we use right angles, sometimes we use combinations. There are a lot of different techniques for lips. Sometimes we'll use a cannula for lips. So for right now, though, we are going to move on. This is the migration that someone mentioned before, and that's not what you ever really want to have. You don't want this migration for sure. Typically, too much filler in the lips, or it's been manipulated by the practitioner or by the patient who will floor around with their lips and move the stuff out. You're dealing with a clear colorless gel for that. All right, we are going to move on to regenerative filler. This is called a solid filler. So now we are going, I'll show you more before and after cases later on of all of these things here too. But let me just show you this. This is, imagine if you had a filler that was a solid thread and you could place it precisely wherever you want. And imagine that when you place it, as it breaks down, it stimulates the body to produce its own collagen and elastin. And if you understood that concept, you understand solid filler PDO threads. PDO stands for polydioxanone. We got ours exclusively from Vsoft Lift. That is by far, these are the best threads on the market. Whether they're smooth or lifting, I'll show you a lifting case too, which is really amazing for this. But this is what polydioxanone does. Polydioxanone is a suture material that's been around for a long, long time. Brain surgery, heart surgery, pediatric surgery, dental surgery. It is a very slow absorbable thread that, as it breaks down over the course of 3 to 4 to 6 weeks, the body's response when we're using it for aesthetic uses is to produce its own collagen. And that's exactly what this micrograph cross-section shows you. These are the big threads down here. All of this is brand new collagen. This is epidermis up here. And that is really fantastic. And that is what you are, that's what you are dealing with here. Neocollagenesis, all those different things. Polydioxanone threads. This is not the right way to do threads. On the left, that's a joke. On the right, that's real. People go ahead and put in all these threads. If you ever see a case like this where they're putting in all these threads, they are using the wrong thread. That means they're using a thread from a company that's very weak collagen biostimulator, should never need this many threads. You will not see it with AAFE techniques. You will certainly not see it with Vsoft Lift. You never need this many threads for this. And pretty much, if you know anything about PDO threads, this is an equivalency chart. For every one Vsoft Lift thread, whether it's lifting or smooth, you're going to need 3 to 4 Nova threads, 4 to 5 Mint PDO threads. You don't want, the point is, use the minimum amount of threads for the maximum result, not the maximum amount of threads for a minimal result. That's the point, demonstrated perfectly by this patient you're going to see right now. Just want to show you a demonstration of how we use solid filler smooth PDO threads. Then I want you to see the after, and I want you to see the skin condition. It's amazing. Here we go. We love placing smooth PDO threads, and you're going to see why. We're going to use them as a solid filler here because this patient is a younger patient and has lost some volume or naturally didn't have it. We're going to replace it with solid filler smooth PDO threads. These are going to be the Vsoft Lift brand of threads here. So the patient's been cleaned up. The patient has had some topical anesthetic, the Comfortox BLT, for about 10 minutes on there. And so you can see this is going to be a fairly comfortable procedure for this patient. We are using, like I said, Vsoft Lift 29 gauge by 30, 29 gauge by 40 smooth threads, or you can use 29 gauge by 40 twisted threads for even more. So let's talk about the technique a little bit and what we are doing here. So you can go ahead and see these PDO threads come in a sharp needle, pulling back on the skin to retract it, stabilize a little bit, going into what's called the subdermal plane. And when you go into the subdermal plane, they will go in very, very easily and very, very nicely there. And you'll just know it'll kind of glide in. If you are too superficial, it will go ahead and be very hard to get it in. You'll feel a lot of resistance, and the patient will feel a lot of pain because you will be in the epidermal layer or close to it. And if it just sinks right in, then you are too deep in the subcutaneous fat area. And once you get them to place, 360 turn, hold down that area before you take it out, and you take them right out. You can see get a little bit of bleeding. Now, in that area, in that one nasolabial fold, all you saw were 4 V-Soft Lift PDO threads. If you were using any other brand of PDO thread, and that would be 4 to 5 times the number of threads you would use. Why? Because these PDO threads, the V-Soft Lift brand, produce the most collagen by far over any other PDO thread on the market there. And you see some of these crazy cases that people use for clickbait on Instagram and Facebook, where they put literally 10, 20, 30 threads in that little area or in one area. It's just amazing that anybody would tolerate that. But you as a clinician need to use the best tool to get maximum efficiency, maximum collagen building with the least amount of treatment. And that's why we're using this with AAFE techniques. We can, when you take AAFE certification training, live patient certification training on smooth PDO threads, we'll show you exactly what patterns, exactly how to go for this. Now, what's happening here? Now that you know the technique, what are we leaving behind? We are leaving behind an absorbable suture material, and that's polydioxanone, known as PDO thread, used for 50 years in cardiac, brain, dental surgery, and it's a slow absorbable suture. And that slow absorbable suture is going to be left behind. And from an aesthetic point of view, what the body's natural reaction as it slowly goes ahead and breaks down is what? Building its own natural collagen. That's going to stay for 2-3 years, depending on the patient here. Now we are going to go ahead and do some nasolabial folds. You can place one at a time. You can place all of them and then take them out at a time for this. What's the advantage of this over dermal fillers? The advantage is there's no jelly filler, so you are never going to cannulate an artery. You're never going to have a vascular occlusion or a vascular compression, because imagine if you had a dermal filler and you just had it in a solid, thin piece that you could precisely place anywhere and then grows collagen over time. It's a great collagen biostimulator. That's exactly what you've got with solid filler smooth PDO threads, and they're by the name solid filler because that's exactly what they are. So now let's talk about the different areas. Going into the nasolabial fold, just follow the fold up. And again, the subdermal plane, which is going to be a little bit below the dermis, right below the dermis. And that is the most comfortable plane, the easiest plane to get them into, but that gives you the greatest amount of collagen building. By the way, it's not just collagen that you're building. You are building collagen. The body's building its own natural collagen and elastin. And that is what gives the skin really some great texture there as well. Now you can see, just following up the nasolabial fold from a few different angles there to place the solid filler and eventually place the collagen exactly where you want it. And in a patient like this, that is young, that has started to develop nasolabial folds, they don't need many PDO threads, as you can see, if you're using the right kind of PDO thread, number one. And then in a month, and then we repeat this about once a month for 3 months, depending on the patient. Sometimes they only need one treatment. Some patients need more than one treatment, and that would be about 4 to 6 weeks apart till they get good collagen building. This patient actually only needed a couple of treatments here, and you'll see the result in the before and after very soon. But you'll see it grows its own natural collagen. So you never look overdone. You never look bloated, as sometimes people look with dermal fillers because of all the water attraction, or sometimes people overtreat with dermal fillers. You won't get that here. And so dermal fillers are great. Just know what tool is best from your toolbox for the clinical situation that you're doing. But the V-Soft Lift brand, because they have a special polymer coating that no other brand has, they are the best, and they more slowly break down, give more collagen building, and that's what you want. That's what your patients want, with the least amount of threads and the maximum result. that is going to last 1 to 2 and possibly even longer, depending on the patient's metabolism here. And you can see we did both sides, nasolabial folds, marionette lines, oral commissures a little bit. And here's the great result that you can see. Look at the before where she started to develop those folds, and look at the after. Beautiful natural collagen. You can learn to do this too, and you should add this to your practice for sure, especially if you already use Botox and dermal fillers. It's time for you to get AAFE certification trained today. That's the way to properly learn this so you can deliver this to your patient. And her skin is so much better. Oh my gosh. I mean, again, it's not, we do this for skin condition. We do this for collagen biostimulation. This young patient got her cheek built up just with smooth PO threads, 3 treatments, about 4 to 6 weeks apart. But look what it did also to their acne scarring. It is really, really incredible for this. Yes, there is a course just for smooth PO threads, and I'm going to show you lifting PO threads too. And so we'll kind of tie them both together, and we'll show you what the course is for that too. Gorgeous lips with filler, and we used smooth PO threads in the for the lip borders to really pop them out. They're really, really incredible for this. This patient had everything: neurotoxin, fillers, smooth PO threads, a lot because of her skin condition that really helped it out, but also the collagen biostimulation. Again, it's not just about the Botox, the fillers, the smooth PO threads. I want you to think bigger over time in terms of that, but you got to get started somewhere. And again, that's why you get started with a core 4. You get started with a dream practice package of 2 courses. You get started somewhere, or if you're already doing this, you've got to add on. You've got to continually add on. Just some of the economics of a case of smooth PO threads. Again, just this without the neurotoxin or the fillers. And you can see how these cases add up. And over time, literally, you're investing in yourself when it comes to tuition. That pays off very, very quickly here. You have got, this patient had 10 V-Soft Lift Smooth PO threads on each side of their face. Your cost, $100, patient fee, $650 to $850 per treatment. Treatment time is literally 5 minutes. You saw how many we put in 5 minutes. Again, chit chat takes a little bit longer than that. But once you get some experience, these go in. If you've had level 1 Botox and fillers, these go in very quickly. And you can learn it very quickly. Number of treatments, 1 to 3 treatments, about 4 to 6 weeks apart. Each treatment is $650 to $850, lasts about 12 to 24 months, or it lasts as long as their collagen lasts. I mean, that's pretty much what it is. It's their natural collagen that you are replacing here. How can you learn this? The AAFE has the only virtual training, CME certification training on smooth PO threads, and it comes with a monthly live virtual Q&A Zoom session, full AAFE on-demand certification training, 1 box of smooth PO threads, and it's included because there is a module where you will go ahead and learn to place smooth PO threads on either a chicken breast or a skin pad. The AAFE will tell you exactly what to get. Right now, it's $500 off. It's not including any of the other packages there, at least with the box of smooth PO threads. So this is a huge deal. If you're already an AAFE member, $797. If you're not, you'll pay a little bit more. But this is one case pays for all of this. It is great. Yeah, there are very few contraindications. And what Thelma, what you just posted is not a contraindication for this, because literally you're getting the body to create its own collagen. Now, if they're compromised, you may not get as good of collagen biostimulation. But I will tell you this, thus there are really 4 injectables, and that is Botox fillers, solid fillers, smooth PO threads, and lifting PO threads, which we are going to cover next. For that, you've got to know them all because we use all 4 of these. And there's all kinds of other things. There's a lot of regenerative. There's a lot of different kinds of things. But learn smooth PO threads. You do not have to leave your home or your office. And this is a great deal because, first of all, it's discounted right now, but you get a box of smooth PO threads that comes with it. You're going to use 1 or 2 packs in the training, and then the rest of the box, you're going to get your money back and tuition and so much more for that. All right, take a look for this. I don't even know this actress's name here, but 26 to 51, This is how people are aging now. So if any of you know her name, please feel free to post it. Hopefully, I'm the only doofus on here that doesn't know her name, but I guess she's very famous. My team sent me this. So if you know who this is, go ahead and put it on. Now let's talk about lifting PDO threads. And even if you're just getting started, you got to know what, again, the future lies for you, because you want to build up your practice. And then after this, we're going to talk a little bit about the practice, financial impact. If you're a nurse, if you want to own a med spa, what are you looking at? What are your potential incomes from doing some of this? Whether you're a dentist, you're a nurse, a physician, we'll get into that a little bit there too, because really that's really what it's really all about. Kate Beckinsale. Okay, thank you very much. I'm not even sure I said her name right. This lifting PDO threads. You know those big jowls on the bottom? This is a different kind of filler. This is a solid filler that is literally going to give a physical lift. You're not going to get a physical lift with those jelly fillers. You're just not. I mean, it's just impossible for that. But this is going to be a physical lift. Again, a little bit more advanced, but a lot of you are advanced already. It's time to start thinking about lifting PDO threads the AAFE way, because most of the other ways really don't work very well for this here. All right, let's go ahead, and then we'll show the training packages again when we get to it. All right, lifting PDO threads, they look different than smooth, because smooth are just smooth. They're only there for collagen biostimulation. These are here to go ahead and hook into the tissue and physically lift it up. Don't worry about the different types of PDO threads, although there are two basic types. One is called barb, which is the top one. The other ones are called molded threads. Again, this is the VSoft lift line. Why do we use VSoft lift? The strongest threads on the market. For one of these, you're going to need 3 to 4 of just about any other thread that's out there, number one. Number two, FDA cleared class 2. You cannot put your license at risk by using a non-FDA cleared thread, and there are a lot of them on the market. You have to be careful. And again, equivalency chart is going to be, again, one VSoft lift. Just the other popular ones are Nova Threads and Mint PDO, although you're seeing less and less of them over time for sure. And this is the patient we're going to see. Here's her before and after here for that. Look at that jawline. Look at the jowls. She's a relatively young patient, late 30s for that. These are what the Mint PDO or the Nova Threads, or if you ever see any other thread where the cases look like this, these are 20 to 30 threads on each side of the face. You don't want to, I don't want to do these kinds of cases. And by the way, they'll tell you, again, these are all things that they posted, and I've taken these other courses there too. Certainly that's not the AAFE way. I mean, this is almost a surgical case. They sedate the patient. Afterwards, they put them on steroids and antibiotics and narcotics. I'm not telling you anything that I wasn't trained on and that they'll tell you all the time. That's not the way we should be doing threads. The result's a decent result. It's almost a surgical case. By the way, and if you're using 20 threads on these lifting PDO threads are definitely more expensive than the smooth PDO threads. Your cost for just the threads in this case, not an AAFE case, not a VSoft lift case, is probably $4,000 to $5,000, which means you're charging the patient $8,000. I don't know what you're charging the patient. You're not going to do a lot of patients with this. This will use 4 VSoft lifting PDO threads rather than 20. And again, if you're the patient, what would you want? Would you want 4 or would you want 20? I would bet you want 4. Let's go ahead and show you a part of a case just so you get a taste of what lifting PDO threads can do the AAFE way.
In this training video, we want to focus in on a few things here. We're going to follow pretty much the regular AAFE protocol. The few things we are going to go ahead and do differently. Here we are going ahead and just giving some anesthesia right at the injection point at the pilot hole and at the end of where the threads are going to end up. And in this one, we are going to use a molded thread. This is going to be a 19 gauge by 100 millimeter molded thread, and that's going to give us a little bit more strength. And you're going to see a couple of things that are going to be a little bit different here. But pilot hole, 18 gauge pilot hole, we're going to go ahead and do that. Remember, when you're doing this, this already will set you you into the right plane. So this is really crucial. And you see with the 3 vectors that we're doing here, we are going along all 3 vectors and going side to side to open up those that area there. And now we are going to go ahead and take a micro cannula with lidocaine and pre-tunnel this area. And as we're going to go ahead and see, we're going to use the non-dominant hand and just keep going curtain over the curtain rod, and it's going to go through just fine. And retrograde injection of some local anesthetic here, lidocaine, 2% will do the job just fine. And we don't really need epinephrine because we don't need any long working anesthetic here at all. We're just going to go around all 3 tunnels. The important part of this is to be in the right plane, because this will send your thread into the right plane already here. But I want you to notice the pattern that we're doing, and let's have a discussion about going ahead. And as you see in the nasolabial fold, we're going to go past the nasolabial fold. We're going to go past the marionette line. We're going to go all the way down to the jowl, all 3 here in doing these tunnels. And when we place these threads, the reason in this case we are going past the nasolabial fold, we don't always, is because the patient has a fairly flat cheek. When there's a flat cheek like that, it's easy to get past this area. And you're going to see that right now. Now, this is a molded thread with an L-shaped tip, and you can see we're going to punch through the ligament right there. You can do that with a sharp tip, you can do that with an L-shaped tip, and as we go past the nasolabial fold, and you don't have to go to the hub of the molded thread, or any thread for that matter. You don't have to go to the hub, you just have to get to where you want to end up here. So flat cheeks, that's when you can go past the nasolabial fold. When the cheek has a curve, it makes it very difficult to get all the way to the nasolabial fold, and you don't necessarily need that in many cases there as well. Whether it's a molded or whether it's a barbed thread, it doesn't really matter. Now we're going to go ahead along that second vector here, as you can go ahead and see, and we're going to go pinch that in and really go ahead, give a little push there, but use the other hand to pull the tissue up over the cannula, but also punch it through those ligaments. As you can see, that's the areas when you come up to an area that you need a little bit more of a tug, that is when you can go ahead and do this. Now, the L-shaped cannula in these molded threads here are, imagine you took a blunt cannula and you only shaved off horizontally half of the blunt, so you have kind of like a flat end. That is called an L-shaped tip, and we cover that in the AAFE training course. So you can go ahead and review the different tips. There's sharp, there's full blunt, and then L-shaped here. L-shaped really does the job quite nicely, just like a sharp, to go through the ligaments here, but you're not worried about coming out the other end of the tissue here. As you can see the how it was poking through the tissue, but wasn't coming out the other end here. The molded threads come with an L-shaped tip here, and you can see we got all 3 in fairly well. And again, one went to the hub, the other didn't necessarily go to the hub. Now I want you to go ahead and see the pull that you're going to get and appreciate from the beginning and what you'll see at the end. And even now you can see the view of that jawline, how it's really a little bit diffuse and not very sharp. But you're going to see between the lifting threads of 3 vectors and now the 1 vector along the jawline, you're going to go ahead and see just a beautiful, sharply defined jawline, and a little bit more cheek as you pull everything up and really lessen the jowls on this patient here. Same thing here. We're just going to go ahead and use a micro cannula, deliver some local anesthetic in this area with the retrograde injection. Once we get by all the way to the end to where we want to get to on that. And sometimes it takes a little bit of work to go ahead and do that. So make sure that you can go ahead and feel where the end of that tip is and give that a nice string of lidocaine as you go ahead and pull out. That's the pre-tunnel. Now we're going to go ahead. You can kind of see the flat end right there as it goes into the tissue here. Takes a little bit of a push, a little bit of a twist to go in there. Use your non-dominant hand, curtain over the curtain rod. Feel where the end of that tip is and just get it to place as far as you can like it. Every time there's that extra little push, that is going through the ligament and mandibular ligament in this case. Again, doesn't have to go down to the hub. That did the trick. And now you go ahead and pull right back. And now we can go ahead and really go ahead and give this a reverse pull to make it really nice and tight, and get a scissors to go ahead and snip off the ends of all three of these. It doesn't take very long. Your first couple of cases, especially in training, then we want you to really take your time and really do the job here very nicely. But once you get good at this, this is a total of a 7-minute video, 4 threads, get it in there fairly quickly from start to finish. This is a procedure that you are here to learn and all to do. But appreciate the fact that when do we go past the nasolabial fold? When don't we? When we do it in the nasolabial fold and you can get around the cheek because the patient's got flat cheeks, then it's worthwhile getting as much grab as you can if that's what you need. Why a molded thread? Molded thread is going to be stronger than a barbed thread if you really want more of a pull. But now appreciate and look how beautiful that jawline is. We're going to get the patient all cleaned up. You can really see a much sharper jawline. Jowls going, jowls are just gone here. Beautiful, beautiful result. And as you know, just get them cleaned up, put a couple Band-Aids on, give them post-op instructions. But there you see molded thread in use. There you see a different pattern of when we go past the nasolabial fold and marionette lines. And all of this is something that you should be doing with some experience and great training by the AAFE.
And here is an absolutely amazing transformation before and after here. Take a look at that jawline. Take a look at the nasolabial fold and at the oral commissure and also the marionette line. It looks like a different person. And that is really what you're trying to accomplish. Everything is nice and tight, snatched jawline, lifted cheek as part of this there as well. So many advantages when you learn how to use the right AAFE techniques, the right PDO thread that is the strongest with the least amount of threads. That's the way to do it. It's time for you to get AAFE certification. Train today. Okay, and there is one more topic, and it's about the money. It's about let's talk a little bit about impact to practice and that kind of thing. But let's just finish out this topic here. Here's the economics of this. For example, this case, look at this case. It's amazing. There's nothing you can do with Botox and fillers to get this kind of a result to lift up the face. Now you go in with fillers and fill everything in that needs to be filled in. But that's why this is all part of it. And again, this is all part of a long-term strategy. If you're just starting out, just getting comfortable, you've already taken a level 1 or have not yet taken a level 1, you're going to start with Botox and fillers. Taking a level 1, you are going to take more Botox and fillers. Level 2, expand out the areas, then start introduce solid filler smooth PO threads, which are very easy to learn once you learn how to give injections in the face. And then you go ahead and do this. But this kind of case is impossible. There's nothing you can do other than a facelift with her that's non-surgical, other than lifting PDO threads. So it's amazing. We use 6, 3 on each side. There's no other thread that can go ahead and do this. So your cost of the threads is $210. Patient fee can be anywhere in that range, $1,750 to $2,500. Treatment time, 20 minutes. Number of treatments, 1. This will last 12 to 24 months, sometimes longer, sometimes not as long, just depends on the patient and their face and facial structure. But again, you add fillers into this to keep things supported. These can last a really long time. So if you want to learn lifting PDO threads, 2 ways to do it. You can buy the Dream package and use it for level 1 lifting PDO threads, and then level 2 lifting PDO threads. Those will be 2 separate courses on 2 separate days. AAFEtraining.com. You can go there or go to AAFEspecial.com and buy that package tonight and get all the bonuses, although I think they're running out of packages. Or you can go to vsoftlift.us, and they are, again, they are the best threads on the market. They have PDO thread packages that you can buy. You buy this package, you can go to AAFE group training, just like you're going to go ahead and do with the Dream Practice package. If you buy a big enough package, they will actually do a private training in your office on lifting and smooth PDO threads and send an AAFE trainer. All still AAFE training, all CME certification, live patient training, but they'll send somebody to your office for all of this. Now let's talk, I'll show you some before and afters, but then let's go ahead and talk a little bit about let's talk about impact to your practice. No matter if you're a physician, dentist, nurse practitioner, PA, for that. All these before and afters, you can go ahead and see. Some of these older patients, especially, have looked at, again, I'm not knocking facelifts. We all, there are times when there's nothing else to do with a facelift. The question is, can you put off a facelift? By the way, we do a ton of patients after they've gotten a facelift, because a facelift is not the end all and be all, right? They're going to keep aging and they're going to keep sagging. A little lifting pedio thread, a little bit of filler here, a little bit of neurotoxin. It's amazing what you can go ahead and do. This is an AAFE member. Her name is Erin. She's a nurse practitioner. Went through just about all the AAFE curriculum for that, and then looked in the mirror and said, you know what? Could use a little bit of help here. Lifted her up first in terms of treatment progression in a total facial aesthetics case like this. What would you do? You would lift them up first, give them the support with lifting pedio threads, then go back in with fillers, give her volume where she still needs volume, because you're not going to get as much volume just from lifting pedio threads. Neurotoxin, as you can see, the forehead all the way to the left from before to all the way through. That can be done at any time. It can be done straight from the get-go, and then you can see her from the side here as well. That's a transformation that takes about 2.5 months. Yes, she's going to need maintenance. She's okay with that. She doesn't want a facelift. Maybe eventually she will need a facelift for that. There is so much that you can do for patients, but you gotta get started. And if you're started already, you gotta keep going. That's what the AAFE really is all about. That's why we have a curriculum. But I do want to go, I'll just show you a couple more before and afters. And I do want to go ahead and talk about financial impact a little bit. Everybody knows who that is, right? And look at her between 29 and 52. You could almost say she looks better at 52 than she did at 29. Probably wasn't getting as many services at 29, but it's about maintenance. It's about skincare, but it certainly is about injectables and keeping all of this going for that. Don't know what she had. No, I don't know. Maybe somebody in the AAFE does treat her, but I don't know what she had. But this did not happen by itself. That's for sure. And this is a great patient. I love this patient. Her name is Jane, by the way. That is the same person. You got to lift them up. You got to fill them up. You got a neurotoxin that will smooth out the wrinkles and all of this. And then you've got the haircut she does afterwards. That's all on her. That's not us. But what's great about her is we're about a mile and a half from a Nordstrom's, and she runs the entire cosmetics floor at the Nordstrom, and she tells everybody where she got this stuff from, and she tells them exactly where to go. She refers people to us all the time for all these kinds of treatments, and they're all looking for cosmetics for that. But it really is to get to total facial aesthetics. With a core 4, you are well on your way to total facial aesthetics. And there's so much you can do with that. But dream practice, all of it will be part of it. All right, let's talk a little bit about the business part for that. I'll go back to her in a second. Let me go back to her right now, since you mentioned it. What would you do with a patient like this, ideally? First of all, again, when you get trained in all of these things, if you're just doing Botox and fillers, you can still do a ton of stuff for her on Botox and fillers, fill up the lost volume and that kind of thing. The ideal treatment plan later on, once you get trained on all these things, is you would lift her up with lifting pedio threads first. Neurotoxin can be done before, after, same appointment. It really doesn't matter as long as you're not treating in the same areas. Lift her up first, then apply your filler, and then smooth pedio threads for skin texture, collagen biostimulation. Just depends on her needs. If there is a sequence to some of these, just like any other treatment in any other medical, dental, or nursing profession for that. I mean, there are all these different things, all of which you'll learn in the AAFE. And again, learning is a journey. The AAFE is absolutely a journey. Get started, or get more training if you've already had some training. We will help you literally all the way through. Great question. Chocolate chip 1908. I love that name. How long after lifting can you apply filler? Usually about 2 to 3 weeks afterwards. Some of you asked that before, and I'll answer more clinical questions before too. Just having a little hard time navigating this, but I will get it. I'll answer some of those questions. We'll come back for more clinical questions in just a few minutes here for this. But here's what I referred to before. Any aesthetic practice, whether it's in a dental office, a medical office, whether it's a med spa specifically, 50% at least is based on Botox and fillers. That's where you've got to get started. Again, that's what the training really is all about. That's where you get started. You add skincare, esthetician services, body contouring, regenerative aesthetics, you see, is only 12% of this now. These are your hyperdilute radius, these are your Sculptras, your PRP, PRFs. We've got courses in all these things. Then you get into devices. The top really should be more about devices in general, but there are a lot of devices. But you don't start with big devices that cost $100,000, $150,000 with that, that each one will tell you it's the latest and greatest thing until that same rep goes to work for another device company. Then that becomes the greatest in everything. Your initial skill in Botox fillers, and in fillers, I also mean smooth PDO threads and lifting PDO threads. Again, I'm trying to get you to see the progression here. Don't just, get a level 1. That's going to give you 80 to 85% of all the Botox and fillers that you're ever going to do are those foundational bread and butter Botox and fillers. Then you go and you've got to keep adding on to it to really build a successful practice there. That is exactly where we want you to go ahead and see. But that's the base of the pyramid for sure for all of this. Well, let's go ahead and talk about med spa aesthetic practice, and then I'm going to go to medical and dental offices of existing offices if you already have one for this. If you want to start a med spa or work in a med spa or start a med spa, but let's talk about being an owner, because there are a lot of you that want to. Whether you are a nurse practitioner, or a PA, whether you are a dentist that has a practice and now wants to do an offshoot, wants to do a separate practice just of aesthetics and med spa type and hire a nurse, hire someone else, same thing with a physician for that. If you're the owner of a med spa aesthetic practice, that again, you're about 2 years in, you've really started to build up this practice. The owner income is anywhere between $300,000 to $450,000 annually. And again, these are averages. Some do less, some do more, and a lot more for that. Top 10% owners are $500,000 to $1 million, often with multi-location models. We talk about all these things in the Med Spa on-demand business practice course that we have. That's part of the bonuses that go with the packages tonight. Profit margins in the industry standard is about 20 to 25%, which means if you have a mature med spa doing a 1.5 million revenue, it's not that hard to get there. Typically leaves the owner with 300 to 375 in pure profit after all expenses. Basically, it's what you get paid for that. That's what you can look forward to. There's a process. You got to build up to that. But certainly, this is why so many people want to start. Now, again, no matter what kind of professional you are, we've got the resources and we've got the partnerships to tell you who can help you get a med spa open, what you need from the legal, from the accounting, how to hire employees, all those different things for that. If you're already a dentist or physician who has a practice on their own and you're adding this to your practice, we'll just go pretty much to the bottom line. And this is from 1,000 AAFE member survey of dentists or physicians or NPs who had their independent practices added on Botox and fillers at about a year out after taking a level 1 or a core 4 Botox and dermal fillers. The average increase of their existing production was an extra $32,500 a month of production a month, in addition to everything else that they're doing. They're not giving up the rest of their practice. Some were doing a lot more because they like to do this stuff. It's a lot easier than traditional dentistry or traditional medicine, and they would hire associates to do all of that stuff, and so they would do a lot more than this themselves. And we have dentist physicians doing $100,000 to $150,000 a month just of injectables. Typically, those are the dentists and physicians and even nurses that add this onto their practice. They're doing PDO threads, they're doing TMJ, oral facial pain trigger point therapy. They're doing all of these things as well. So there's incredible amount of, and this is why people are drawn to it, just like all of you, that there's so much potential to this, to do the things you really want to do, the freedom that you get. I mean, everything that comes along with really setting your own career path, and having the most fun you're ever going to have in healthcare. I mean, that's the bottom line. So let me take some questions, but definitely follow us at Facial Aesthetics on all different platforms, afespecial.com. That's where we've been sending to you all night. I think maybe a couple of packages are left. I don't know if the AAFE actually added on packages because people were asking. Maybe Haley or Emily can tell us, you know, have they sold out, or are there a few packages left that the AAFE added on for that? We have the best faculty in the world. I will tell you that for sure. They are all successful in their own practices. We don't have faculty that just teach and don't do. These are people just like you. Okay, that's who you want to learn from. Not just from the clinical, but you can talk to them about their practices there. We have so many resources in the AAFE. We give courses all over the country. The stars are AAFE Training Center locations. I'll answer clinical questions in just a minute. Here are the 3 packages again for the last few that are left. $49.97 Core 4. Come to these 2-day events where you'll get all 4 of these courses. Choose from the first 4 that you see, including the 3 of them are exactly the same in both. It's either level 2 Botox, or if you're a dentist, you may want a gum builder instead of level 2 Botox, or you may want level 2 Botox. It doesn't matter. The AAFE will work with you with whatever you want. This is the Dream Practice Package. These are 2 courses, and both of these come with these amazing bonuses. This one's worth over $13,000, up to $1,500 injectables to be used at the course. 1 team member per course. That's another $1,500. All the different bonuses, but the big bonus again is that med spa aesthetic practice, just updated, $19.97, and you're getting it as part of this right here. Where am I going? I'm going the wrong way. Dream Practice Package. Again, these are 2 courses, but imagine if you bought 2 of these dream practices, you'd be at $6,000, and this is at $49.97, $1,000 less for the Core 4. So again, the Core 4 is designed for those of you just starting out the level 1, and take all 4 of these. You will be much better prepared for your med spa, for your aesthetic practice, for your dental practice, medical practice, if you're just getting started on that. Dream Practice, 2 courses, still going to come with a number of amazing bonuses. You can do level 1 Botox and filler, level 2 Botox and filler, level 3 Botox and filler, inject and dissect cadaver lab, lifting PDO threads, level 1 and level 2. You can really mix and match any course. And then this is the Career Growth Online Certification Special. If you're already an injector, by all means, then you can go ahead and buy 1, get 2 free. Your choice of what these are, and for $9.97, that is an incredible deal for all of that there. So again, keep asking. Emily and Haley, you might want to post your emails. You might want to post your emails so people can get hold of you afterwards, because we're going to sign off in just a little, in just a few minutes, but I am going to take some questions here. I'm going to let them handle the training questions here. We had some questions on PDO threats, so let's go ahead and do that for that. And the questions are always the best for that. Let's take a look, trying to get ahead of these questions here. Okay, well, let me take a look here. Oh, no, they had PDO threads done or took the course. Yes, you'll get some swelling. Dr. Bree was phenomenal. All of our faculty, she's great, but all of our faculty is phenomenal. Can't wait to see the results. Yeah, you'll get some bruising and some swelling. Typically not much, but you definitely will get some bruising and swelling with those. Let me just see if I can get some of this. Can you do PDO and filler the same day? Typically not. You're going to want 2 weeks before, 2 weeks after. In other words, they had filler 2 weeks before, wait 2 to 3 weeks to get lifting PDO threads or smooth PDO threads, and vice versa on the other way around for that. Let's take a look. For the lifting PDO thread. So again, what we used before, it was a cannula with pre-tunneling, and that is that pre-tunneling sets the whole thing up, because then it is so much easier to go ahead and follow that tunnel with your PDO thread for that. Yeah, if you can't bring a patient to a course, you'll find one at the course. I mean, it happens all the time. People start treating each other for that, and that's all fine. Best educational experience, which is what we want for you, is the best educational experience, is we absolutely want you to go ahead and bring a patient, because you're going to take that patient home. And Botox takes 2 to 10 days to kick in. Fillers take a few days to really settle in. This way you can go ahead and monitor the patient, see for yourself what is going on. Each one of these are 10 CEME. All right, Emily got that answered. That's all good. Let's take a look for that. Again, some of these other questions, Emily and Haley can answer. How long can you save lip filler for after opening, or any filler after opening? Again, we don't recommend. We recommend, from a clinical and practice management point of view, use it up. Find a place in the face to use it up. That's not hard to do it. Some people will tell you 1 week or 2 weeks. It's just, everybody's a little different. If I was going to save it for 2 weeks, I would never save it for more than 2 weeks and just toss it. The only thing I would save it for 2 weeks for is going to be for maybe, if they need a little enhancement after 2 weeks, then we would go ahead and possibly use that. After that, you should go in the garbage. Do not save it for months at a time. Certainly don't tell the patient, because I mentioned this before. They'll say, I paid you for this. I want that little less piece of filler a year and a half later, and I remember that you have it somewhere. Forget it. It's contaminated. It's not going to last very long. There are questions if you should even use it at all. Just telling you what in the real world, what people do. Sometimes they will go ahead and they will save it there. Oh, this is a good question. Does the thread poke out of the hole, and can you feel it? It should not poke out of the hole, and if it does, you're going to have to cut it a little bit shorter for that. But when you saw us cut that especially the lifting PDO thread, for that, we really pulled it tight. We made sure it got buried underneath the skin, because as soon as you cut it close to the skin pops up, that thread disappears for that. So, occasionally it may poke out just because you didn't cut it, close enough, and absolutely you can fix that. I mean, it's easily fixed. We do host international dentists all the time if you have a license in your host country, so you can reach out to them. I think I got those questions. All right, hang on. There's a lot more, but these all are training related. Let's take a look. When advancing the cannula, I didn't see what the question was before. Is it possible to have an interruption? Hang on, I'm trying to get this thing to move. It's possible to have an interruption. Rickwell, if you can post that again. When you advance the cannula, you won't have an interruption, but you may come against the ligament that you may have to push through just a little bit. Somebody asked before about twisting PDO threads. We cover them in the course. If they're just like placing smooth PDO threads, except they're twisted on the outside, just requires a little bit more of a push. If you already took the course, then certainly email us at the AAFE, and we can hook you up with one of our full-time faculty who can walk you through twisting PDO threads. Just requires more of a push. You put them in exactly the way you would put them in as a smooth PDO threads. What went wrong when you see bumps under the skin with PDO threads? What went wrong is that you were probably too superficial in the plane. Solid filler, smooth PDO threads, lifting PDO threads, both of them, you've got to be in the right plane, and each one of those threads have to require a different plane. But lifting PDO threads, if you're too superficial, then you will get some kind of like buckling, and it'll kind of like, a little bit of pinching of the tissue here and that. 99% of the time, you can smooth that out at the time that you see that, or even within a week or two later for that. So, I mean, there are ways to do it. That's why we pre-tunnel. Once you're in the right plane for lifting your smooth PDO threads, it goes so smoothly. And it's all about learning what that right plane really is for that. I mean, that's for sure. Okay, that's it. Is it possible to have interruption from previous PDO lifting thread if patient wants to have some more PDO threads, either lifting or volume? It's going to be pretty rare unless you're in exactly the same place or the same plane, and they recently had PDO threads put in there, but you're not going to really have an interruption there for that. I finally got that question out where I could see it, for that. Let's take a look. Again, a lot of these things are sequenced for that. Each one of the live patient training, we're actually really go to the next slide where you see all the packages together. All the live patient training are 10 CEs, are 10 CMEs, and they're all participation, obviously, because they're all hands-on for this. All right. How long does it take for the PDO to dissolve? So again, the smooth PDO threads takes about 6 to 8 weeks. The lifting PDO threads, because they are a thicker thread, they typically take about 8 to 12 weeks to dissolve. But once they dissolve, it's replacing all of it with collagen, and that's what maintains the lift for that. Lifting PDO threads are incredible. I will tell you this about lifting PDO threads, that is such a myth about them, because you'll hear this occasionally from plastic surgeons for sculpt draw, all these advanced aesthetics. For those of you who are advanced, they'll say, oh my God, they'll leave so much scar tissue and that kind of stuff. It doesn't leave hardly any scar tissue at all over time. Even if you have this repeatedly many times over your lifetime for that. There's another plastic surgeon that just posted something. I don't have it in this program, but I could certainly find it and play it another time. So this is baloney. All these plastic surgeons say, oh, they have to deal with the scar tissue. Any facial plastic surgeon has done a 5-layer neck lift. Okay, there's tons of scar tissue just from being alive or just from being anything else. Or if they've ever done a C-section or anything else, we deal with scar tissue all the time. It's minimal. Stop complaining. The whole thing is just bogus. And they're just trying to tell people, come in for a facelift. That was pretty much his message. And he's right. Any plastic surgeon that's decent, facial plastic surgeon, the lifting PDO thread is not causing anything that they can't handle should the patient want. We do a lot of lifting PDO threads for post-facelift patients. They're not going to get another facelift in a year. Something dropped, one thread, tighten it up. I mean, the whole thing takes exactly 5 minutes. It's really, really incredible for that. You're going to love that cadaver an ultrasound course. It's amazing. It's better than anything else out there. It's one of these big courses with 50, 60 people. It's an intimate course. You're going to have a lot of time with the cadaver for all of that. Sierra, again, ask Emily or Haley what you're looking for, and they will get you all set up. The prices that QR code for avspecial.com, those are the prices. You sure not really need anything else on the discount. But if you have any problems, email Emily at facialaesthetics.org or Haley at facialaesthetics.org, and they should be able to help you. Let me just check one more place for questions because there are a lot of them. I tried to get them all for this. I have lots of cases of lips with smooth threads. I don't have it in this program, so we'll show it at future programs. Any advice for new med spa owners? Yes, work. And a lot of advice. It just depends what the question is for that. But it's about, if you want one piece of advice for a new med spa owners, or if you're a new injector and you're working in a med spa, build your brand. And that's social media. And just, that doesn't take much. Social media is free. You can post. Doesn't matter anymore if you have 1 follower or 1 million followers. It's really more about the content, but you've got to put it out consistently, and it doesn't take very long for that. So that's a little piece of advice. There's obviously a lot more for all of that. All right, I think that is about it. You folks have been fantastic. There's still hundreds of you on. Cannot thank you enough for this. All right, I will answer. Wait, I got a couple more here. Should a new med spa owner expect to break even or lose money in the first year or so? You should at least break even and even make a little bit of money, but there is going to be an investment going in, absolutely investment going in. But again, with some marketing and with the word of mouth, which is still your best marketing, is word of mouth. And tell people that you absolutely tell people that you're friends with, Tell every great patient that you have, I don't care if you only have 5 great patients, when they come in, tell them to refer other patients because people refer people just like them. So ask for referrals. Absolutely ask for referrals. Julie, thank you for your kind comments for that. So we've got a lot more on med spas, and that's any of these packages that come with the med spa training, you will really love it. Thank you to all of you. Thank you so much for the kind comments. And we've been on for a long time. Those of you who got packages, and thank you, Emily and Haley, for helping everybody out for that. We cannot wait to work with you. Again, just register after we hang up. If you can still get packages, try to secure a package. Don't worry about location or anything else. Get it before it expires at midnight. The AAFE may have added more packages. I don't know, but absolutely get it before it expires. Don't worry about location. Emily, Haley will help get you into the locations that you want. And let's get it going. You're going to be working with all of us in the AAFE, not just me, all the great people in AAFE. We are going to make you successful. And it's a journey. We are all going to be in this journey together, but we are really going to make you successful in all of this. Thank you for being on, everybody. Take care. Continued success. Can't wait to work with all of you. We will talk to you all again real soon. Thank you, Emily. Thank you, Haley, for helping out and being on here tonight there too. All right. Take care, everybody. We will talk to you all again real soon.